today we will be unveiling a crucial, yet often overlooked, factor in the effective management of blood pressure. This presentation aims to provide a clear health perspective on this important topic. To begin, it is essential that we establish a solid foundation. We will start by defining the basics of what blood pressure is and recognizing the significant health challenge that high blood pressure, or hypertension, represents. Let's examine the fundamentals. Blood pressure is quantified by two measurement metrics: systolic pressure, when the heart beats, and diastolic pressure, when the heart rests. This pressure is essential as it performs the vital function of circulating blood throughout the body. For healthy adults, blood pressure should typically be below 120/80 mmHg. This leads us to the silent threat of hypertension. High blood pressure is highly prevalent, affecting a significant portion of the adult population. If left untreated, it can lead to severe cardiovascular complications. The danger is compounded by the frequent absence of symptoms, meaning damage can occur long before the condition is discovered. So, what are the current methods for addressing this issue? We will now explore the conventional approaches and establish strategies that are widely implemented for effective blood pressure control. The pillars of management are lifestyle modifications. Key dietary adjustments include reducing sodium and increasing potassium intake. This is coupled with regular physical activity, as moderate exercise is proven to significantly lower blood pressure over time. Furthermore, achieving a healthy weight is critical to reduce overall cardiovascular strain. Alongside lifestyle changes, we often use pharmaceutical interventions. Various classes of medication are available, which target different mechanisms within the body to lower pressure. Physicians prescribe these medications based on individual risk factors and other existing conditions or comorbidities. For these treatments to work, adherence is key. Consistent use is crucial for long-term effectiveness. Beyond these traditional strategies, there is a hidden factor. We will now discover an often overlooked mechanism that significantly influences blood pressure autonomic imbalance. This is a critical piece of the puzzle. Allow me to introduce the autonomic nervous system. It is composed of two main branches: the sympathetic system, which controls our fight-or-flight response, and the parasympathetic system, which manages our rest and digest state. This system provides automatic regulation for involuntary bodily functions like heart rate and digestion. A harmonious balance between these two branches is absolutely imperative for optimal health. This is where chronic stress has its physiological impact. Prolonged stress results in sustained activation of the sympathetic nervous system. This triggers a hormonal cascade, releasing cortisol and adrenaline, which elevates physiological arousal. The systemic effects are profound, impacting heart rate, vascular tone, and renal function, all of which are direct contributing factors to hypertension. Let's begin by examining the connection between sympathetic overdrive and hypertension. This condition manifests in several ways. Firstly, persistent sympathetic activity leads to vascular constriction, which narrows the blood vessels and consequently increases resistance. Secondly, under stress, the heart is prompted to pump both harder and faster, which increases cardiac output and raises pressure. Finally, stress hormones can activate the renin-angiotensin system, a pathway that elevates both blood volume and overall blood pressure. Having understood the problem, we now shift our focus to the solution, which involves turning off this one thing. The key is to activate the parasympathetic system, which is the body's natural mechanism for blood pressure regulation and restoration of a calm state. To achieve this balance, several mind-body practices are highly effective. Deep breathing techniques, for example, directly activate the vagus nerve, which promotes relaxation and helps to lower the heart rate. Mindfulness meditation is another powerful tool that reduces stress hormones and fosters a calm physiological state. Additionally, progressive muscle relaxation works by systematically releasing physical tension, which signals the entire body to relax. Beyond specific exercises, broader lifestyle adjustments are crucial for achieving autonomic harmony. Prioritizing quality sleep is vital, as restorative sleep is necessary for nervous system repair and balance. Implementing a digital detox by reducing screen time can minimize sensory overload and excessive mental stimulation. Furthermore, increasing nature exposure is important. Spending time outdoors has been shown to significantly reduce stress and improve overall well-being. In conclusion, we advocate for a new perspective centered on holistic management. This involves an integrated approach, combining conventional medical treatments with non-conventional strategies to achieve the best possible outcomes. A core component of this is empowering individuals understanding the principles of autonomic control gives patients a powerful tool for their own health. Finally, it is crucial that these strategies are personalized, tailoring interventions to an individual's specific stress triggers and responses.